So, Florida continues to move forward with its reopening plans, and that's despite the fact that at least there's one study that says that it has the potential to be the next epicenter of the coronavirus. So, we're going to bring in Dr. Bob Lahita joining us now for the latest developments on the virus. Dr. Bob, I'm sure you saw the story out of Florida of these group of friends, 16 ladies, I believe, that all went out to the bar. Florida has reopened bars and restaurants. And they were like, let's go out. They said they had been very, very good over the past a couple of months in terms of isolating themselves and social distancing. But in the words of one of the women who got sick, out of sight, out of mind when it came to the virus, and then they all ended up contracting it. When you hear that phrase, out of sight, out of mind, it must sort of send chills down your spine.
It does. And, you know, to see the film that you just showed from California of that intensivist who looked exhausted, that's exactly how we were in the New York metropolitan area, totally exhausted, seeing so many people dying, etc. I think if the young people of Florida and young people in general, millennials and Gen Z people who think that they're invincible could see how the infection wreaks havoc, the importance of wearing a mask is not to be taken lightly. It's a very, very important thing. And to also keep your social distance. The reason for that is you have to consider everybody a potential infectious vector. So if I'm sitting in a bar, first of all, I don't know why they're sitting in a bar, but I guess they open the bars. You're close to people. You're sharing beer glasses or perhaps other kinds of drinks. You're hugging and kissing people that you haven't seen for several months. And therein lies the cause and the root of the progressive infection. So yes, we're going to see an uptick in Florida. We're seeing upticks in Texas. We're seeing it everywhere where people are letting their guard down. It's unfortunate, Anne-Marie, but that's what's happening, and that was so predictable.
Mm-hmm. Doctor, as you know, President Trump is getting ready for his first rally since the start of the coronavirus pandemic. One senior official with the administration is now suggesting that those at a high risk of severe illness not attend. You recall, Doctor, the story that we covered and many other news organizations covered of the super spreader who was part of a choir up in Seattle. One person who infected 52 people. It was a horrific story. And I just wonder, when you've got, I believe that venue where this event is happening holds some 19,000, 20,000 plus people. What are the risks inherent? And what advice do you have for those who insist on going?
Well, the risks are clear. If you've got let's go back to the choir with the person who's singing. When you sing, you create a major vapor of saliva, etc. And all those people were unmasked and they're all singing. And that's how 50 some odd people got infected from one infected choir member. Now picture yourself in a Gigundo incubator, the Tulsa amphitheater or whatever it is, where you have several tens of thousands of people all yelling and screaming, most of them probably not wearing masks. So this is like a big experiment. We're going to see the spread of this virus in that group. And I would agree with the organizers that people that have heart disease, lung disease, who are severely diabetic or severely hypertensive should stay away, because they're staring trouble in the face. This is going to be a very big experiment to see if a couple of vectors, and all you need is 2 or 3 people who are infected, who are screaming and yelling, and are going to be spitting on everybody, and those people are going to get infected and spit on other people, and so on and so forth. It may not happen right away, but 2 weeks out from that event, will show that we are liable to see many, many new cases in the Tulsa area. And of course, that'll spread throughout the state of Oklahoma.
Sorry for cutting in there. I wanted to ask you about a headline that I think probably a lot of people have already seen, that made a connection between the severity of your symptoms if you contracted coronavirus and your blood type, that some blood types may result in less severe symptoms. Can you tell us anything about this?
Yes, I've I've been watching this for some time. Actually, when we had our daily meetings, when COVID-19 was ripping through our medical center, we had a meeting and we decided, and we had heard from the Europeans, particularly the Italians, that people of blood type A had much more severe disease than people of blood type O. Now, I have no particular information about type AB or any of the other variants like O positive, O negative, but we know that people with type A blood seem to have a worse disease than people with type O blood. Now, it could be an association of the blood type with immunogenetic markers, because as you know, the expression, maybe you don't, the expression of the antigens or the foreign so-called materials on the surface of cells really constitute the blood type. It's we type and cross with antibodies in the hospital every day, every hour of the day. So it's possible that there may be some linkage, and that's where we leave it. There's some research now going on to see why the virus seems to have a better time in people who are type A than in people who are type O blood.
All right. Pretty interesting stuff. Dr. Lahita, thank you so much.
Thank you. Good to be with you.